There's a name you need to know. Normand Mounier. He was 66, a quadriplegic, and he did not die from his disability or a terminal illness. He died because the Canadian healthcare system abandoned him in a hallway. In March 2024, Normand was hospitalized in Quebec for a respiratory virus. He was left on a stretcher in an ER hallway for 4 days without the proper mattress needed for someone in his condition. He developed horrific bed sores. He pleaded to be transferred to a long-term care facility equipped to handle his needs. He never got that transfer. As his partner, Sylvie Brosseau, told the coroner's inquiry into his death, it was horrifying. The last 2 weeks of his life were unbearable. Unable to live in pain and filth any longer, Normand turned to Canada's Medical Assistance in Dying program. Normand wasn't terminal. He wasn't dying. He was simply too neglected by our healthcare system to go on living. And in Carney's Canada, that's now a valid reason to be euthanized. Now, this is not a tragic exception. It's a systemic trend. According to the federal government's own 2023 annual report, 15,343 Canadians received euthanasia last year. That's nearly 5% of all deaths in the country. Let's let that sink in for a second. Medical assistance in dying is now tied with stroke as the 5th leading cause of death in Canada. Now, this isn't compassion. It's institutional failure in a lab coat. And the scope of who's eligible for MAID is ever expanding. Over 4% of last year's cases were patients whose deaths were not reasonably foreseeable. In other words, they weren't terminal. They were just hopeless, neglected, or out of options in our publicly funded, publicly rationed healthcare system. MAID, in fact, is the only thing in Canada's crumbling healthcare system where things move quickly. You can wait months, even years, for cancer treatment, for surgery, for long-term care. But if you're poor, disabled, mentally ill, the state will rush you to the front of the line for death. Now, what does that say about our values? The answer is grim. In a country where palliative care is underfunded, where hospitals are overcrowded, where pain management and housing are hard to come by, medical assistance in dying is becoming the state's go-to exit strategy for the inconvenient and the costly. It's not about dignity, it's about dollars. If Canada really cared about dignity, we'd be fixing the reasons people want to die, not offering them a lethal injection when they fall through the cracks. Normand Mounier didn't choose death freely. He was cornered into it by a healthcare system that left him quite literally to rot, and then offered a way out that was quicker than fixing the problem. This isn't medical assistance in dying. It's a bureaucratic bullet for people who've been failed by every other part of the system. And it's only going to get worse. For Rebel News, I'm Sheila Gunn Reid. Canada throws billions at publicly funded healthcare, and yet Canadians are choosing to die in greater numbers than ever. These people need help, not homicide. Please go to helpnothomicide.com and sign the petition today.